This is 5P Podcast, the first international regenerative medicine and anti-aging podcast that will give you the tools to age with the greatest health, wellness and appearance. It is directed by Professor Dr. Jaime Rodriguez Quintosa and Professor Dr. Debbie Binsky. We welcome you to the 7th episode. We are your host, Sandra Sola and Professor Carlos Galante.
We are at the headquarters of J. Reese Productions Wave Smith Studios, the podcast accelerator that walks you through the steps to create a successful podcast from scratch. We invite you to subscribe to our YouTube channel at 5P Podcast to learn more about this topic. As you well know, we have with us the 5P Podcast ambassador, Professor Dr. Debbie Binsky, the Queen of Anti-Aging Medicine and President of the World Council for Preventive, Regenerative and Anti-Aging Medicine, WOCPM. Welcome, Professor.
Thank you, Sandra, for nice introduction. Professor Carlos, Professor Jaime, and Dr. Ursula. The famous Dr. Ursula is an accomplished dental surgeon with a demonstrated history of working in the medical practice industry. She is the owner and the head of the highly regarded Ain International Polyclinic in Dubai, United Arab Emirates. Her extensive expertise
as well.
Yes, and includes endodontics, dentistry, orthodontics, dental and oral surgery, and platelet rich plasma treatment. In addition to being MSc in laser dentistry and preventive anti-aging medicine. Dr. Ursula, very famous in the world, and she's constantly seeking new ways to deliver exceptional healthcare to her patients. Welcome again, Dr. Ursula, the board of World Council of Preventive Anti-Aging Medicine. We like to start the podcast with the same question, which is very important to all our guests.
Thank you for having me.
Thank you, Ursula. So the question is, why did you decide to dedicate yourself to anti-aging regenerative medicine?
I believe in regeneration and healing from our own body. I know that our bodies are capable to do a lot of regeneration only just to get little help. And that's why it's guiding me to do that. I believe in the repair and healing of our own body.
Thank you, Doctor. In the first International Health Conference in Bali 2023, your lecture was about platelet rich plasma and its uses to scar management. Could you briefly explain what PRP is and how it works?
Okay, PRP is actually autologous concentration of platelets, which we are extracting by centrifuge, by acceleration, and helping the gravity is helping to extract the cells of the blood. And one of them are the thrombocytes. The thrombocytes are cells which are having a lot of growth factor. So they are very capable for repair and healing in all kind of body, all kind of tissue. The hard tissue, the soft tissue, building collagen, repairing, healing after operations, repairing after injuries, even after chronic diseases. Now more and more it's used even in the orthopedic surgery, which I admire. The use of the injection of the platelets. That's why I'm giving priority to heal the body with PRP, with the platelets rich plasma. That's what is called. It's platelets rich plasma. The plasma, it's full of platelets, which they have lots of growth factor, which can applies in all the body to help to heal and repair and regenerate.
What are the main benefits of this PRP?
The main benefits is just healing. Healing, regenerating, and repairing. That is the main process of the PRP.
And
the application, of course, are wide all over the body. They can bring collagen, so they are in aesthetics very good. They can go with the mesenchymal cells to repair injuries in the spinal cord. They repair the nerves. They repair all kinds of tissue injuries. So the platelets, it's a wide range of use for the platelets. We can use them aesthetic, we can use them injuries, we can use them in chronic diseases, we can use to repair organs, we can use them all over. They are our body cells with a lot of growth factor.
And
and we know the growth factor is the main factor for repair, for healing.
And is PRP painful, the administration? What is the application process like?
Okay, the PRP, it's injectable or it's just on the surface. Injectable, it's like a little bit, it's painful when you inject it, like small injection, which you can make topical anesthesia. And then the pain is almost nothing. But when you inject the PRP, actually is not painful and is not afterwards any pain on the spot. It's no pain there. It's just if was a pain, maybe it's for a little time because you are touching the area, and then the healing, it's so nicely a release of the pain. That's why we are using actually the PRP also for pain. If we have a pain, knee pain, back pain, and all these things, if we inject PRP, the pain release and can hold for a long time. Depends of the age of the patients. The PRP can hold, an injection of PRP, indeed of cortisol, can hold 1.5 years more than the cortisol. And it's a healing as well. It's not just removing the pain. The pain is gone because the healing processes and regenerative processes on the spot.
And what kind of results can patients expect, and how long do they take to appear?
Because we are having growth factors, so the growth factor means that something has to grow. Usually the process, it's starting from the immediately when you are injecting the PRP, you feel much better. But the best results are from 3 to 6 weeks when you can see really the results that they are shown. But also the first time when you inject them, because they are making a little bit of irritation on the place, good irritation. So they are making they are bringing the circulation. The circulation it's accelerate. Then we have also like a small edema and the wrinkles. That's I'm talking now about the aesthetics when we are using them for aesthetics. So when we are injecting them on the place, we can see a reduction of the wrinkles. But the wrinkles to disappear, it's going for 3 to 6 weeks, and it's a really nice look, which is holding the pains of the age of the patient, as I said. If it's about 40, it's holding for 1 to 1.5 years. If it's more, of course, because our cells are a little older, like with me, they're holding like 6 months, but they're still do the repair. It's not going back like the wrinkles are not going back to the start point, and they are really repair. They are not injuring. They are not for a limited time, and then we have to inject it again. No, some results they stay. We can support the results, and we can support them like. The first treatment, it's like we do the treatment and then we can control like in a 3 months. And then if we don't need it, we don't inject it. If we need, we can support. And otherwise, we don't need many treatments, maximum 3 treatments in 2 to 3 months time.
Thank you. We remind you that we are interviewing Dr. Ursula Manson, head of the highly regarded AIN International Polyclinic in Dubai, United Arab Emirates, and a cutting-edge specialist in platelet-rich plasma for scar management. If you are enjoying this episode, don't forget to subscribe to our YouTube channel at 5P Podcast.
Yes, very interesting, Dr. Ursula. I remember your very nice presentation in the International Congress in Bali and also in Paris. Yes, you already answered about how many PRP sessions, and you're talking about scar management, but I also know this is also good for the wrinkle, acne scar,
Absolutely.
and also
Yes.
for the neck. Yeah, I think your knowledge is really wide, and you have experienced so many patients. So, in your experience, how many PRP sessions are usually needed to see optimal result, and do they need to do again for maintenance?
Okay, this is, as I said, depends of the person which we are and what we are treating. If we are having a younger person, so the platelets, I think we can start to use them for aesthetic reason, for removing the wrinkles after age of 40. There is needed only one session, but we can decide it more after the one session when we can control the person after coming after one session to see the result. If it's needed more or was enough, because it's also the body. We involve the body, we involve the growth factors from the body. We are giving the growth factors, but also we are pushing the other cells to cooperate. So that is the point. For younger people, it's needed just one treatment, but as I said, still we have to decide on the spot. And we have to decide also how old is the person, how fit is the person as well, what the person is eating. Of course, we cannot help the person and then the person is smoking, drinking, and doing all kind of damage to the body.
So, if they have healthy lifestyle, it's need less.
Yeah, it's a long, yes, it's a long result. Yes, as usual on everything.
Depend to the condition of the patient. Thank you, Dr. Ursula. And is PRP safe for everyone, or there are any types of people who shouldn't undergo this treatment? What do you think?
PRP is safe, can be used in everyone. Now, we can have thoughts about people which they have a thrombocytopenia because it's too little of thrombocyte. We can think about them. We can think about HIV patients a little bit. It depends how the cells are working because they are getting a lot of what is called treatment for depress of the immune system. And then we can be a little bit thinking about, and I will think about blood thinner people. Not that we cannot, the blood thinner, it's applicable on the thrombocyte. So I still think that if we stop the treatment for a couple of days, we can use also on blood thinner. But here it's like 50-50. But otherwise, PRP is acceptable in anyone. It's acceptable for soft tissue. It's acceptable for hard tissue. It's acceptable for operations, especially now on the spinal cord. What I'm following the results, it's amazing. It's amazing.
Okay, thank you. And what are the most common side effects of these
No side
PRP?
effects.
No?
No side effects. PRP doesn't have side effects. It has only good effects. Straight effects, but not on the side. Maybe some extra good side effects, but
Okay.
not bad side effects.
Good to know. And
Yeah.
can
It's our body product.
yeah, exactly. And can PRP be combined with other anti-aging treatments?
Yes. It's good to combine with the mesenchymal cells. This means all the stem cells. It's good to combine them. It's good to combine with other treatment like ozone therapy to activate them. It's good to activate them with the lasers, low power lasers, which I'm doing. Some doctors, they are activating the platelets with some citrates and calcium hydroxides. I'm not what is against. It depends on the person which has experience, but can be. But I think it's the best to be combined. Yes, they can be combined. Absolutely. They can be accelerated. Yeah, but we have to be careful also. You know, you cannot make everybody to run marathon.
Yes.
Then can be side effect.
And
Then we get too tired.
is something the patient needs to know to prepare for a PRP session or administration of PRP? They need to prepare or do something?
Yeah, we can advise them to eat good. We can advise them to drink a lot of liquid because then the extraction of the blood is easier. If they are more healthy, we get healthier growth factors. So yeah, we advise them to be healthy when we start the procedure.
And
to don't have some viral infection like if they are sick, like they have some influenza or some cold, it's better to wait. Yes, absolutely. It's better to wait. To don't be. They have to be healthy. They have to feel healthy.
And what happens if I have some I don't know, not injury, joder, enfermedad.
Wound.
Some sickness.
You mean?
So, no, I mean like some sickness. Yes, I didn't remember that word. For example, lupus or something like this. Can we use my own PRP also?
Yes, I think so. Yes.
Okay.
It's autoimmune disease, but can be used. Yes.
Okay.
Absolutely.
Mm-hmm.
Yeah.
All right.
I didn't see in the literature anything against autoimmune disease. Maybe we can think a little bit here that if you get some allergic reaction like heavies and you scratch a little yourself because your body, lupus, it's autoimmune disease. Mm-hmm. So can be a little thinking about.
Okay, so we were talking...
yes. But we can do a proof. We can put the PRP like under the skin, like when we are, and we can see the reaction.
All right.
We can inject a small amount, see the reaction.
Okay.
I think, yes, we can do that.
So we were talking about the preparation before this treatment. What about the post-treatment care? How should it be?
The post-treatment care is just to put some creams more on the face if it's for the wrinkles. And to continue a healthy life because the platelets are doing their job. It's no post-treatment. We are just waiting for the best results from the platelets.
And is PRP effective for all ages, or is there an ideal age to start the treatment?
PRP, it's effective. It's just the duration of the treatment, it's shorter because our cells are older. But the treatment is good to start at, you know, they are saying we start to age after age of 20. I can say like between when we are entering 40, I think should be should be started with some treatment, but every age it's capable for treatment. I don't think even 100 years old still we have a growth factor. At our nose it's growing, our ears are growing, so it means that we have some growth factor still there. So we can use it. And I don't think that is limited, but the effect is limited of the age, and the duration of the treatment is limited. So younger person, the duration it's longer. It's going maybe to 2 years. Older person, maybe 6 months, but it's still available. That is important. Other things are not important. And healthy person.
Healthy person. Thank you, Dr.
Yes,
Ursula.
healthy life person.
Limit.
No,
There is
healthy
no
life,
limit.
healthy life. I'm saying diabetic also can get treatment.
Yeah.
High blood pressure, they can get treatment. I'm not talking about these normal diseases which are bothering the human being. But I'm saying like unhealthy life, like you don't sleep well, you don't eat good, you drink, you smoke, you take drugs, and then you get the platelets and you like they to do the miracle. Of course they will do something, but they are sleepy, they're drunk, and they do slowly job, but they will do job because there's still the growth factor there. We cannot remove the growth factor.
Yes, good to know. Very interesting, Dr. Ursula. PRP very safe because you take from your own blood, and I see so many good results from your before after treatment you show us, and also you wrote in the journal. And Dr. Ursula, I have a question. What would you say to someone who is considering PRP but still has doubt? Maybe they're scared or something. What would you say to the person who need this PRP but still doubts?
Don't be scared. Go on. And you will be happy because you will get definitely results from the treatment. Definitely. They will be big or small. They should be repeated or not. But go for it. If you are waiting, nothing happened. But if you go, you will get the results.
Thank you very much.
Thank you. Thank you, Dr. Ursula. And thank you also for coming to this 5P podcast. And I'd like to remind you today we have interviewed the very famous Dr. Ursula, the owner and head of the highly regarded AI International Polyclinic in Dubai, United Arab Emirates. Her extensive expertise includes endodontics, dentistry, orthodontics, dental and oral surgery, and of course
dermatology as well. Dermatology as well, and medical.
Dermatology as well. Don't forget, you are multitasking, multidiscipline specialist, my dear Ursula. The board of the World Council of Anti-Aging Medicine. Also one of the lecturer for the EFRE International University for the Master of Anti-Aging Medicine. We are happy to have you this time. Thank you for your time.
I'd
Sandra?
like to add something.
Yes.
Application of PRP drops on the eye can heal the dry eye when we are old. I'm using them for myself.
Oh, wow. Wow. Good to know.
Yes, that's not painful.
PRP drops. Yeah.
Okay.
And
how many drops?
3 times a day, 2-3 drops. Yes, and the results are very, very good.
Oh, wow.
Well, yeah.
Yes.
Wow, very good.
This PRP is amazing.
Thank you for sharing.
Yes, we are using also for periodontics when the teeth like to fall down. We are building the soft tissue and the hard tissue. We are having results of getting not all the tissue which is lost, but some hard tissue, some bone as well.
Wow,
Okay,
very
wow.
good. And I'm happy also to hear that you combine with the mesenchymal stem cell. So I
Yes.
love to do that.
Yes. Yes.
Thank you,
We will do
Ursula.
it. We will do it. For the retina, we will do it.
All
We
right.
are going to the eye.
Wow, amazing.
Yes,
Amazing.
yes. I'm going into the eye now.
Thank you. Thank you very much for listening.
Thank you for having me. Thank you.
Thank you. Thank you for listening and supporting this initiative. We invite you to subscribe to our YouTube channel at 5P Podcast. If you want to learn how to make a successful podcast, subscribe to at Wave Smith Studios on YouTube. See you next time, and remember, take care of yourself today to defy time tomorrow.